Hi, my name is Gazi. I am a registered nurse and a radio technician in training. I would like to tell you a little about breast cancer and share a few tips with you about early diagnosis, early treatment, and preventive measures that reduce your risk and increase your chances of survival from breast cancer. October of every year is celebrated as Breast Cancer Awareness Month, and it is also called as the Pink October, as people around the world chose the pink color to commemorate the month and a display of the pink ribbon to raise awareness about the importance of prevention and routine screening for early diagnosis of breast cancer. It is also a time to reflect on breast cancer research and treatment trends and reduce stigma against breast cancer victims. However, I would like to stress that breast cancer awareness is not only an October thing, it is an everyday thing, and we all need to make a pledge to share awareness about breast cancer wherever we find ourselves every day. So let's jump right into it. What is breast cancer? Breast cancer is a type of cancer that begins with the growth of abnormal cells in the breast tissues. Apart from skin cancer, it is the second most common diagnosed cancer in females and interestingly in males all around the world. What are things that you're going to see, or how are you going to feel in order to determine whether you have breast cancer? In medical terms, we call these signs and symptoms. First sign or symptom that you're going to experience is there's going to be changes in the color of the skin over your breast. In light-skinned people, the color of the skin over your breast is going to be a red or pink, and in dark or brown-skinned people, the color of your skin is going to be different from other areas on your chest, or is going to appear red or purple. There's also going to be changes in the size, shape, and appearance of your breast. For example, you have one of your breasts is going to be pointed and the other breast is going to be sagging, or one of your breasts is going to be abnormally larger than the other breast. There's also going to be changes in the texture of the skin around your breast. For example, it's going to look dimpled or like an orange peel, like when you peel an orange and squeeze it, how the hole appear in it. That's how the holes are going to appear around your breast. That indicates you're experiencing bloody or abnormal, foul-smelling, yellowish or brownish discharge from your breast. This is a symptom of breast cancer. If you see the skin of your breast peeling or scaling like fish skin, or flaking or crusting, this is a sign of breast cancer. And lastly, if you're experiencing breast or nipple pain, it indicates a symptom of breast cancer. So what is available? Breast cancer screening is done for women between the ages of 30 years to 74 years of age. For women with a family history of breast cancer, mammograms are done as early as 40 years. This is important for early diagnosis, for better surgical option, and for an effective chemotherapy. For women who are between ages of 40 to 45 years of age, up to 74 years of age, routine mammogram screening is done. Preferably, we chose 45 years of age because we assume that at this age, a woman is done with childbearing and or breastfeeding, and exposing her breast to radiation is not going to cause any harm for women that are less than 40 years of age, preferably between the ages of 30 to 40 years of age. There are other options that are available because we do not want to expose the breast to radiation. So you have the pre-breast cancer screening that is done, the breast self-examination is done, we have the breast ultrasound and the breast MRI. So what is the cause of breast cancer? The exact cause of breast cancer is not known. However, research has found things that increases your risk of breast cancer. These things include smoking tobacco and drinking alcohol. If you have a family history of breast cancer, say your mom or your sibling or an immediate family member of yours had breast cancer, you are at risk of breast cancer. However, I would like to stress that not everyone with a family history of breast cancer end up with this disease. However, you need to do your routine screening in order to rule out the chances of breast cancer. People with larger breasts that has more dense and fatty tissues are at risk of breast cancer, and in these people it is very difficult to detect breast cancer at an early age, and we know that early detection saves lives. And lastly, for those who are on hormonal therapy, long-term hormonal therapy, to have children, you are at risk of breast cancer. So what can you do to reduce your risk of breast cancer? We all know that a healthy lifestyle practice is important to reduce our risk to lots of diseases, and breast cancer is of no exception. You need to start by staying away from tobacco. There is no safe form of tobacco, including secondhand smoking. If you are an excessive alcohol drinker, you want to start by reducing your daily intake of alcohol. And if you do not smoke, please do not consider it. You also need to get to and maintain a healthy weight. At least have about 150 to 300 minutes of moderate to intense exercise. Eat enough fruits and vegetables and whole grains, and reduce your intake of red and processed meat, sugary drinks, and highly processed foods, and avoid prolonged use of hormones. An estimated 30% of breast cancer cases is attributed to modifiable risk factors. So you need to understand what you can do to reduce your risk of breast cancer. Become familiar with your breast by performing the breast self-examination at the beginning of every month. I'm going to be sharing information on tips about breast self-examination in my next video, or you can check my page for more information. If you're in Liberia and its environs, and you're looking forward to do your breast examination, you can go to the Jembali Medical Solution at ERW Junction to get your mammograms, your breast ultrasound, and breast MRI. Breast cancer is not a Goa matter or a witch matter. It is a medical condition, and you need to seek medical care if you're experiencing any